It's obviously my pleasure to be here with you on our 10th anniversary celebration. As I look around the room, we are a group of patients, family members, friends, physicians, researchers, surgeons, oncologists.
And today's meeting is really very nice because it is collaboration with the Center for Pancreatic Disease here at UCLA, and all the speakers that you're going to hear today, plus the patient panel, are all from UCLA. Dr. Howard Reber will be talking about the advancement of surgery and the outcome of surgical therapy, primarily in the early disease that are resectable.
They really fall into two categories. One, which is applied to the tumors that are in the body or the tail of the pancreas, is called a distal pancreatectomy. And the other, the so-called Whipple operation, which is the kind of operation that we do for tumors that are in the head of the pancreas. Nowadays, although the operation technically is pretty much the same, the risks of the operation are much, much less.
Dr. Bennett Roth will be talking about how to manage after surgery, the consequence of surgery, and to improve their quality of life.
There are lots of postoperative problems that vary in severity and in frequency, but the vast majority of them are identifiable and controllable.
Dr. Lee Rosen will review of our accomplishment of cancer chemotherapy before or after surgery.
So most of us will sort of begin with chemotherapy to see what the disease is going to do and how people are going to tolerate the drug, and then consider adding radiation again at a later point.
So we think that the future of cancer medicine is going to be trying to use medicines to prevent the cancer from spreading or prevent the cancer from growing.
Carolyn Katchen will be talking about how to approach the nutrition complication after surgery, and also how to manage the depression and anxiety to improve their quality of life.
And for recognizing that medicine alone is not enough, and that patients and their families need psychologic and other integrative care after a cancer diagnosis.
Barbara Kirkland is really the backbone of the UCLA Center for Pancreatic Disease, and she's the first contact to a lot of the pancreatic cancer patients at UCLA.
You can reach out for this support. The journey is easier with the help and support of your friends, family, neighbors, and of course, some humor.
It is for the first time that we have an expert panel of cancer survival to interact with you and discuss with you about how they handle the disease.
I'm a survivor, 11 months.
A 11-year survivor. Actually, I will be 12 years on April 1st.
Have there been any comprehensive studies of long-term survivors to see if there's some commonalities that can be used beneficially in the future?
I think that the folks that are here, in some ways by happenstance, the right combination of treatment and decisions about surgery and the timing of all of that worked.
But the fight is not over.
And what we do have in common is to live a cancer-free life.
Thank you for all your help and your dedication, and for joining us in trying to see if we can conquer pancreatic cancer.